I'm Jocelyn Malari-Yanzon and I'm a pharmacist. My job really is to explain to patients all about their medications and how they can help them, and it is my job to encourage them to take their medications appropriately and to help choose the most appropriate medications for them. I would have to say patient interaction is really what I love. To be able to go in and talk with patients and help them figure out what's going on. Is it medication related, or how we can help them in terms of their diseases by prescribing medications that are most appropriate for them. For physicians and nurses who haven't had a pharmacist on their team before, I'm doing a lot of helping them to understand my expertise and the role that I can play in assisting their patients with medications, medication education, compliance, and those kinds of issues as well. Pharmacy is very flexible in the sense there's a lot of different career paths even within pharmacy, and so I think if you understand what it is that you want to do, it's very flexible. Being in academia is very different than being in a retail setting, which is also very different than being in the hospital. I think pharmacy school is very competitive, especially now, and so I think you have to definitely make yourself marketable by getting a good GPA and working towards that from the beginning of school if possible. One of the biggest things in pharmacy is communication, and so I think being well-rounded, being involved in extracurricular activities also helps when you prepare and apply for pharmacy school. We have one of the highest paid salaries in comparison to some of the other healthcare fields. They have to do additional training following school, residencies, etc. Pharmacists don't have to, it's not required. And so once you finish school, you are able to get a very high competitive salary, which you don't necessarily have in some of the other healthcare fields.